guys, we're back at home from our little excursion out to run errands and up to the hospital to visit my wife and Trey's mother. But I have to just add a little bit to my last posting about the benefits of capitalism in the realm of healthcare, because there's a few important points I wasn't able to get to in that posting. And first thing I want to add to that is, I personally love insurance companies. This sounds very strange, I'm sure, to most of you, especially if you come from that thought of thinking, that school of thinking that the insurance companies are greedy and want to make money, and they take advantage of the consumers in order to fuel their profits and things of this nature. But insurance company actually provides a valuable service most of us don't think about until you're in a position where you really need them. I have insurance through my employer. My employer offers that insurance as part of our compensation package because they want to attract quality employees. Now, it's debatable whether they've attracted one in me, but that's a separate issue. They hope to attract quality employees to build the product which they wish to put out onto the market. So that's them engaging in capitalism for their own good, and that actually winds up benefiting people like me because I get a wage and a salary and a good job and secure income, and along with it comes this insurance. So then we look at the insurance companies, and we all know they're greedy. They're out to make a profit for their shareholders, for their investors, and so they can give that CEO that huge compensation package that a lot of insurance company CEOs enjoy. Well, I'm personally glad they do that. In order for them to make a profit, they have to insure a great number of people, and the cost of their health care, the cost of the health care for the people they are insuring has to be less than the cost of the premiums that those people pay in order to be covered by that insurance. So you have a very large company like Michelin Tires, who employs someone like me. They employ a couple of thousand more people at the plant I work for. In order to attract quality employees, they're willing to offer this insurance as part of our compensation package. Well, that equals a huge amount of premiums, some of which are paid by our company and some of which are paid by by the employees. But that equals a huge sum of money to be paid in premiums to these insurance companies. Now, they can assess more or less the risk of the individuals that they're going to be insuring, and set those premiums at a rate that will make the premiums that that are paid into them more than the cost of the health care for the people they're insuring. However, for someone like me who has very high health care expenses for my wife, this turns out to be a great arrangement, because there's no way I could personally pay for the hundreds of thousands of dollars worth of care that she's received without an insurance. So I pay approximately $160 to $200 a month on my insurance, and I do that for 12 months a year. That's $2,400, let's say, and I have another $2,000 maximum out of pocket. I pay about $4,400 a year for insurance, and yet these insurance companies turn around and pay hundreds of thousands of dollars literally in health care for my wife. So why do they do this? Why do I get that great benefit? Again, we're talking about the benefits of capitalism. Why do I get that great benefit? Because this company wants to make money in the form of a profit for them, their CEOs, their board of directors, their employees, and their shareholders. And in order to do that, they have to go out and contract with people to buy their insurance. And one of the best ways for them to do that is contract with a company that will buy their insurance by the thousands of policies rather than by the ones and twos and the fives and tens. So by these insurance companies being greedy, seeking a profit, all the things that you hear about that they do, by them doing that, they wind up benefiting people like me and my coworkers who need insurance company insurance coverage for their families.